MS organizations estimate that 2.3 million people are currently living with MS worldwide. Multiple sclerosis is an autoimmune disease that targets the CNS and degenerates a person's ability to do general tasks such as walking. This disease currently has no cure. What is multiple sclerosis? Multiple sclerosis is a disease that causes inflammation and damages the fatty substance that surrounds the nerve fibers, which is called myelin. The myelin sheath helps send messages through the CNS, and when it's damaged, these messages are altered or stopped completely. The MS is the most common disease of the central nervous system in young adults today. The diagnosis usually is between year 20 and 40, and it's more prevalent in women than men. Doctors are currently unsure what causes this disease. There are no direct causes, but some research shows that certain things can increase your risk of getting MS, such as smoking or viral infections. Viral infections often are linked to MS because it causes the immune system to act abnormally, and since MS is an immune system disorder, they think that it has a link. Signs and symptoms of MS varies with every person that has it. Early signs and symptoms usually come and go. Doctors call it clinically isolated syndrome. And there are different types of CIS. Monofocal, which means that you only experience one symptom. And then there are multifocal, which means that you experience more than one. Common early signs and symptoms include blurry vision, colors that appear dull, eye pain, or numbness and tingling of the legs or face. Not everybody that has these early signs and symptoms will develop MS in the future. But if these persist, then the doctor will order a CT or an MRI. Here you can see an MRI that shows plaques in the brain, which is a major sign and symptom of multiple sclerosis. So these plaques cause the brain to work not normally. Besides physical symptoms, our primary symptoms, they differ from the early symptoms. Primary symptoms include bowel and bladder problems, so constipation, not being able to empty the bladder fully, signs and symptoms like frequency and urgency are all early symptoms of MS. Clumsiness or lack of coordination is also a big sign of MS. Makes it hard to walk and keep your balance, and so most people end up with a walker or even wheelchair bound, as you can see here. And then another big symptom is eye problems, such as nystagmus, which is involuntary movements of the eye, or double vision. Muscle spasms and tremors are also very common. Not only does MS cause physical problems, but it also causes emotional problems. It can cause problems with mood and even depression. Since this disease damages the nerve fibers in the brain, it affects your emotions, and not to mention the diagnosis of a degenerative disease is often not easy to cope with. And then secondary symptoms are symptoms that are caused from the primary symptoms, such as not being able to empty your bladder usually leads to bladder infection, and not being able to walk often causes loss of muscle tone and loss of bone density. Like I said, MS has no cure currently, but there are many treatments that are used to lessen the severity of the symptoms. So for relapses or exacerbations, people often take corticosteroids. They reduce flare-ups by reducing the inflammation, and if you can't tolerate corticosteroids, they also do plasma exchange as an alternative. Other treatments are called altering disease course treatments, and they're disease-modifying drugs and can be given IV injection or orally. They have been shown to reduce the frequency of exacerbations, and they slow down the process of the disease, which, if done early enough, can slow down the degeneration and the amount of time that it prolongs the amount of time a person has before they become completely disabled and wheelchair bound. And then there's also rehabilitation, and that varies depending on what signs and symptoms the patient is experiencing, but it usually includes like physical therapy, occupational therapy, and speech therapy. In conclusion, MS is a degenerative disease that affects the autoimmune system. It progressively slows down the coordination and can cause many other problems. It does not have a cure, but treatment is aimed at slowing down the disease and lessening exacerbations. Knowing early signs and symptoms is the key to getting these treatments started and slowing down the progression of the disease before complete disability occurs.